Well, our big focus now, and since the early days of the COVID pandemic, some researchers have advocated a fast but controversial way to determine whether a COVID vaccine works. Intentionally attempt to infect vaccinated volunteers with the virus. Now, in July, a vaccine advocacy group called One Day Sooner published an open letter to the director of the United States National Institutes of Health, urging regulators to allow these human challenge trials. In these trials, volunteers would be injected with potential vaccines and then would be challenged by being intentionally exposed to COVID-19. 50 Nobel laureates, more than 50 professors, philosophers and many other prominent intellectuals have signed this letter. There are 30,000 people from 140 countries who've also volunteered. But as we said, this is controversial. There are those who disagree, like US's Dr. Anthony Fauci, and he called it unethical, especially since we don't know the full extent of the impact of COVID and there is no cure for it. So he said it's unnecessary and unethical. So very interesting concept of challenge trials at a time when we're struggling for a vaccine and hoping to get it sooner rather than later. To talk more about this, we're joined by Peter Singer, professor of bioethics at Princeton University and founder of non-profit organization The Life You Can Save. Thank you so much for joining us from Melbourne. We also spoke to Isaac Martinez, a 2020 graduate of Princeton University and someone who is actually a volunteer for this challenge trial. In fact, I'd like to start with Isaac. Isaac, why do you think these trials are so important?
So there are a few reasons why it's important to have the challenge trials. For starters, it could help speed up the process and the development and distribution of the vaccine, because scientists and doctors will get information right away on how effective a vaccine candidate is. And the challenge trials can be done maybe within way shorter than the regular phase 3 vaccine trials. So the sooner we get out the vaccine to the world, like we know which ones work, the better, the more lives we'll save, and the sooner we'll end the pandemic.
All right. Now, there's still so much we're learning about the coronavirus, the impact it has on our bodies, and there's so much information that keeps emerging on COVID effects. Isaac, since you're a volunteer, aren't you apprehensive if you do, get the chance to be exposed to coronavirus?
A little bit, but I think that this is well in line with other risks for altruistic purposes. So, for example, we don't know, I think the first living kidney donation was successfully done in 1954, and we didn't know, and in the 20th century, we didn't know everything about it, and we still don't know everything, all the risks of kidney donation. We just discovered something recently in the last 10 years. But I don't think that means it's unethical to do kidney donations. There's uncertainty to it, but you are taking a small risk to yourself and saving a life, or maybe more lives, more than one life. And so that's true with the kidney donation, and it's true with challenge trials. So yes, there is uncertainty, just like most or all acts of altruism. But if you actually look at the numbers, the odds of anything bad happening to a young and healthy volunteer such as myself during a challenge trial is pretty low. In fact, there's a greater risk for me donating a kidney than for me volunteering for a challenge trial. So I think that the risks are very acceptable for this.
All right, the risks are acceptable. Professor Peter Singer, tell us your views on this. This is a controversial concept. A lot of people find it very shocking that, you get people to volunteer to actually get infected with coronavirus. But tell us why you think this is important.
I think it's important because the virus is killing people every day. In fact, it's killing thousands of people every day. We are seeing the world death tolls rising. And the sooner we can get an effective vaccine against this, the fewer people will die. And these are not just, ones or twos, but as I say, thousands of people every day. So in those circumstances, if we do have volunteers who understand what they're doing, who understand the risk they're taking, as Isaac Martinez just explained, he understands those risks and is willing to do that, I think we should applaud these people. I think we should accept their offer to help us to get out of this crisis, because it is going to be much, much faster. I think it could cut not just days or weeks, but months off the time it takes to prove that a vaccine is effective. And if we don't take advantage of the volunteers, if we say, no, we don't want to impose a risk on them, even though they know what they're doing and they volunteer, we will be imposing a risk on many more people who are not volunteering. For example, just think of the health workers who have to do their duty and help people who are sick with coronavirus, and we know that quite a number of them are getting infected, and we will be continuing to impose that higher risk on health workers and of course also on older people who, when they get infected, are much more likely to become very seriously ill and to die from the virus.
And but the volunteers, I believe thousands, as we said, have volunteered from over 140 countries, but they're all very young. Does that interfere in any way in judging a vaccine?
I don't believe so. None of them are children, right? I think they're all adults capable of making those decisions, and I don't think we should patronize them and say, "Oh,
no, I didn't mean that. Can they take that decision? I meant that if they're much stronger physically, and we know that coronavirus is much more lethal for the elderly and for those above 60. So would that, given if you do these challenge trials on younger people, would it still help you understand whether the vaccine is as effective? Because a lot of younger people are able to fight coronavirus anyway.
They're able to fight it, but they do test positive to the virus.
Sure.
So I think what we could tell is that they are resisting the virus because of the vaccine in a way that they would not be resisting it if they had not had the vaccine. That's what we need to do. We need, obviously, not all of the volunteers for the trial will actually get the vaccine. Some of them will get a placebo, a substance which is not active against the vaccine.
Right.
And they won't know which, so it will be a blind trial, but we will keep records, and then we will be able to check whether those who got the vaccine are better protected and have a different response or lack of response compared to those who get the placebo.
Right. So it's very interesting because till now, we've heard a lot about the research. We've heard a lot about what scientists and doctors have to say. But this is an issue of bioethics. Of course, you're a professor of bioethics. And we also know that a lot of people don't agree with this. They say that, for example, Dr. Anthony Fauci, who's, best known because he's the advisor for the White House on coronavirus. And he has said that it's not essential, or he feels it's not ethically justified.
Well, I greatly admire Dr. Fauci's expertise on the medical aspects of the virus, but he is not a trained bioethicist. He's not studied the ethical issues as intensively as many of the signatories of the letter who are, like myself, trained in bioethics and philosophy. And so I don't give a great deal of weight to his ethical judgment on that. I think he's making a mistake when he says it's not essential. Essential for what? I think it clearly is essential for getting an effective vaccine as quickly as possible. I don't doubt that we will eventually get a vaccine, but if it takes months longer, then many thousands, hundreds of thousands perhaps of people worldwide will die because of that delay. And for them, it is essential. It is essential that we get the vaccine as fast as possible.
All right, well, let's get Isaac back here. And Isaac, there are thousands of people who've actually signed up to be volunteers, 30,000 across 140 countries. And what is the latest on actually going ahead with these challenge trials?
Yes, so Oxford and for their vaccine candidate, they actually announced in mid-July that they're going forward with challenge trials, and they're collaborating with One Day Sooner, so the organization that I work for. So we're hoping to get those, to start those by the end of the year. The director, Adrian Hill, he has an article in The Guardian, or he did an interview in The Guardian where he talked about this.
All right. So let me also ask you about, how many people don't agree with the fact that, we should go ahead with these challenge trials. As I was just speaking to Professor Singer about the fact that Dr. Fauci called them unnecessary and unethical. Yeah, so there are a few things. So there's, like I said, they can provide valuable information, and he knows that too. But I think that one important thing to remember is that most bioethicists I talk to support this. And Dr. Anthony Fauci, he knows epidemiology, vaccinology way better than I do, way better than I ever will.
But like, I think that there is a group of people, bioethicists, like Peter Singer or
Yes.
TM Scanlon, or Peter Singer, Nir Eyal, Daniel Wickler, and they like specifically study the ethics of medical choices like this. And the vast majority of that community thinks that this is ethical. And like Dr. Anthony Fauci, like he knows like the epidemiology, the physiology behind the virus way better than any of those people. But like, I think that the bioethicists have an important role to play in this too. They say, okay, given what scientists like Fauci say, yeah, that may be true, but we're here to make moral judgments on that. And the moral judgments that the bioethicists have made is that this is ethical.
All right. Well, Professor Peter Singer, last word to you. Again, this is something that's controversial, but as you've emphasized, this is something that we need right now, as even in India here, cases are increasing every day. Over 50,000 cases are being reported every day. Our death count has gone up across 40,000. And, many people have also pointed out that perhaps some of those numbers may also be hidden because we're a vast country and many people and the health services are not really up to the mark. So given that, again, you're saying that it's this is something that needs to be done urgently so we can have that vaccine sooner and save more lives.
Yes, I believe so. And India is a good case because you have now a rapid rise, but still, relatively speaking, for the population of India, you have many fewer cases than countries like the United States. So you can imagine if a country with India's population were to get the same proportion of cases as the United States, which now has something like 160,000 deaths. Well, for India, that could be 500,000 deaths. And in order to prevent that, I think a vaccine is the surest way of preventing that.
All right. And therefore, go ahead with these challenge trials to get that vaccine sooner rather than later. Thank you so much, Professor Peter Singer, for speaking to us here at NDTV.
Yes, thank you. My pleasure.
Thank you.
Thank you.
Well, speaking of India's COVID situation, India's COVID cases passed the 20 lakh or 2 million mark after a record surge of 62,538 new patients in the last 24 hours. And the 5 states that have reported the highest number of patients in the last 24 hours is Maharashtra with 11,514, followed by Andhra with over 10,000 cases, Karnataka with over 6,000 cases, Tamil Nadu with 5,684 cases, and then UP that's recently been gaining in the number of cases it's been reporting with 4,586 cases. Now, if we take a look, however, at the 2 worst affected cities initially when the pandemic broke in the country, national capital Delhi and Mumbai, the situation seems to have steadied. Of course, we don't want to overstate this right now or, remain cautious, but it does seem to have steadied for a few days. Delhi reported cases, as you can see, they're under 1,000. But then again, in the last 2 days, it's gone over that 1,000 mark. Then in Mumbai as well, the daily case count is hovering around that 1,000 mark with daily deaths mainly below 50. Well, to talk more about this situation, we're joined by Ramakant Panda, Vice Chairman and MD Asian Heart Institute from Mumbai. Thank you so much for being with us. Dr. Anjan Trikha, Chairman of Clinical Managerial Group, COVID Center at AIIMS. And Dr. Trikha, I'd like to start with you. Again, we need to be cautious and we don't want to see any resurgence. But do you feel that at this point Delhi is past that peak and, things are steadying now?
Well, it looks like Delhi is past its peak, but then we don't have to let our guards down. It is known that sometimes in a large number of countries and cities, the second spike comes. We have so far been able to take care of the peak which came in the last month, but we are not letting our guards down, and nobody should let its guard down. We are ready for the worst, but at the present time, we are slightly more comfortable.
All right, so that's something that's good to know. Dr. Panda, and if we look at Mumbai situation as well, it does seem to have steadied, though now we're hearing about a lot of cases being reported from, the cities and the satellite cities adjoining Mumbai.
Yes. See, you have to understand that compared to other viruses, this is not cyclical or seasonal. There is no up and down. If you don't change our behavior, if you don't control our behavior, again it's going to go up. Or it has proven everywhere in the world, including all over India. So now that it is stabilized in Mumbai, all of us citizens have to have, continue with our behavioral change. Those 3 most important things: physical distance on 6 feet, wearing mask all the time and frequent hand wash or use gloves. And another very important information that has come out recently is the severity of the disease is dependent on the amount of virus that you take inside the body. So if you are wearing mask all the time, what they found is the almost 95% times, even if you catch the virus, you will be completely asymptomatic, which is far, far better than the average population. So my strong recommendation will be, especially in cities like Mumbai, Delhi, where the people are crowded, 5-6 people in a room, use the mask all the time. I will strongly recommend use it while sleeping also. Because the amount of
Really?
virus that you take inside, the amount of virus that you take inside is directly proportional to the type of symptoms you get. You get more virus inside, you get more symptoms. Of course, this is in addition to those risk factors, elderly people, diabetes, blood pressure, etc. Even you take out that, if you are wearing the mask, this is some of the information recently come out, which a lot of studies have shown the amount of virus you ingest, it comes inside your body while breathing, is directly proportional to the severity. You get more virus inside, more severe disease you get. You use the mask all the time, you'll be surprised that 95% of the people who are wearing masks, when they got a COVID, they are completely asymptomatic.
Right, and
like
speaking
Mumbai
of
or
these...
Delhi,
Right, and speaking of these asymptomatic people, what was very interesting with the serological surveys that happened both in Mumbai and in Delhi, if we can just talk about that, the fact that in Delhi they found that around 23% of the people already had antibodies in them, and most of them were asymptomatic. So, Dr. Trikha, that is the challenge, isn't it, that there are many asymptomatic people walking around, and we may think things have steadied, and so what would you say about going forward? We're now looking at opening up schools, etc. So that is a worry as well, isn't it? And all these things have to be kept in account.
Yes, I think that is what is most important issue is. There are a lot of people, as you've said, about 23% who will be going around with antibodies. That would mean that they have been exposed to the virus. Many of them or many other people could have been asymptomatic carriers, and they may be infecting other people. So this is where the challenge lies. This is where the change in habit is important. A mask should become an essential part of your clothing. You shouldn't be leaving your house without a mask. And similarly, maintaining a distance should also become essential. We are going to have a big challenge in Delhi when the schools open, when the metro starts. And I think if all of us make it a part of our body systems to wear a mask, to have enough space among two people, and then even a small thing like going into an elevator. If there are 4 people in an elevator, please don't be the 5th one. Let it go up, maybe use the stairs. Let the elevators be for older people or for patients or for people who can't go up the stairs. Stop overcrowding. Overcrowding and the viral load are 2 important things. It's already been mentioned that a lot of infection would depend upon the viral load which we get. And a viral load can be decreased if all the people are wearing a mask and you are not going into crowded spaces. The challenge lies ahead, maybe in 3 weeks or 4 weeks, when the school open, the universities open, and the metro starts.
All right. Well, thank you so much, Dr. Anjan Trikha, and you'll stay on with us for our viewer questions. And thank you so much, Dr. Ramakant Panda, for joining us and sparing your time for NDTV. Well, with that, time for us to slip into a short break. On the other side, our viewer questions segment. Stay with us. Welcome back. You're watching Coronavirus Facts versus Myths, and it's time now for our viewer questions. We have with us Dr. Anjan Trikha, Chairman of Clinical Managerial Group, COVID Center at AIIMS. Thank you so much for staying on, Doctor. And our first question is from Ayan. Let's play out that question.
So my question is, does the impact of the COVID-19 for an infected person depend upon the amount of the virus that has entered the body, or it entirely depends upon the immunity of that person?
Well, it's a very interesting question. He's asking if it depends upon, the amount of virus that enters the body or the immunity of the person, since immunity has been something that's been in a lot of focus since this pandemic began.
Okay, the answer to your question is that it would depend upon both. The viral load one is exposed to is important, but at the same time, if somebody is immunocompromised, then a small viral load can cause a severe disease. By immunocompromised, I mean that somebody may have a malignancy, somebody may be on medications for, let's say, various cancers, chemotherapy, or somebody could have an inherent disease which decreases the immunity. So any kind of infection in patients who are immunocompromised is more serious and more grave, and the effect and the outcome is bad.
All right, and we have another question, this time from Ludhiana, Harshdeep Singh. Let's play out that question.
Please suggest the immediate first aid that we should give to a person who is suffering from breathlessness.
The immediate first aid, if somebody is suffering from breathlessness, is to make him comfortable on a bed, get him head up, give him a couple of pillows so that he can breathe well. Patients who are, or anybody who is breathless, if you make them lie supine, that is on their back, or prone, that is on their abdomen, they will not be able to breathe well. They can be on the bed, maybe sitting up, and this is the least you can do. And then shift them to a hospital, and if you have provision of oxygen, then you can start that, but maybe that is not available at the bedside or in the house or as a first aid measure.
All right. Well, thank you so much, Dr. Trikha, for taking those questions. And, well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.